Hi everyone, it's such a pleasure to be here today with you. I really wish we could have done this in person, but COVID had other plans. But we have a very, very exciting session teed up for you today. We're going to be talking about delivering cardiac or virtual cardiac rehab at scale, lessons learned from patients, providers, and payers. And I think today's session is really going to be unique because we're going to have some very interesting perspectives from all the key stakeholders in delivering virtual cardiac rehab. So really excited to jump in, and thank you. I think we have, just looking at almost 150 people on the webinar today. So good audience, and it's very exciting. So to kick off, I'm going to introduce myself. My name is Ade Adesoya, co-founder and president of Moving Analytics. Our mission on Moving Analytics is to empower people with tools to live life free of cardiovascular disease. And our flagship product is the Moving Virtual Cardiac Rehab Program. That's been very successful and has gotten payer coverage from many commercial payers and many health systems, and thousands of patients have completed the program. Today, we're going to be, joining us is going to be Beth Kramer, who is the Service Line Director for Cardiac Rehab at Allegheny Health Network. And we're going to talk about Allegheny Health Network and Highmark Health Plan's experience in implementing our program. So to just kick things off, I'm going to allow Beth to introduce herself.
Hi, everybody. My name is Beth Kramer. Just like Ade said, I'm a System Service Line Director for cardiovascular rehab for Allegheny Health Network. Been in the cardiac rehab field for about 26 years now, working my way up from a clinical EP up to management and now my service line role. Very excited for the opportunity to be engaged with Moving Analytics and working with them to adopt this program into Allegheny Health Network here in the very near future. So thank you, Ade.
Thank you, Beth. The next speaker today is going to be Faith Buckle. Faith, you want to introduce yourself?
Sure. Thank you, Ade. My name is Faith Buckle. I'm a nurse as well as having a bachelor's in exercise science. I'm the product lead for care management with Moving Analytics, and I've been with Moving Analytics for about 2 years. Prior to that, I spent many years working in outpatient cardiac rehab.
Thank you, Faith.
Thank you.
And we have a very, very exciting guest, John, who is actually a graduate of our program. So John, do you want to introduce yourself?
Thanks, Ade. Yeah, my name is John Fisher. I live right outside the Pittsburgh area, and I participated in the program last year, right after my heart attack, and I have nothing but excellent things to say about how it worked for me and the results that I received. Can't say enough about the program.
Thank you, John. Definitely looking forward to getting into the depth of your experience. So to kick this off, we're going to allow Beth just talk about Allegheny Health Network, how the organization is structured, and the experience with the motivations for implementing virtual cardiac rehab, especially during the COVID period, and her experience. So Beth, I will advance the slides for you, but you take it over.
Okay, sounds good. Again, I'm from Allegheny Health Network, and that is under the auspice of Highmark Health. So we call them our parent company. Within Allegheny Health Network, we actually have 10 hospitals. We just opened Wexford Hospital this week, and that is going very, very well. Within Wexford Hospital, we do have an outpatient cardiac rehab that was already functioning within a off-site wellness center, which was encompassed by the hospital, and they added on to that facility. But we do have 10 hospitals over the Allegheny Health Network with a mixture of inpatient and or outpatient within them. We do have 8 outpatient locations. And looking into Moving Analytics, we knew that we had opportunities to improve, particularly participation rates, because we knew that a lot of our patients in-house with events like John had, a heart attack or open heart surgery or some kind of procedure, were in our in-house, but we got referrals for cardiac rehab. It didn't mean they attended due to barriers such as transportation issues, patients needed to get back to work, or that they just couldn't commit to brick and mortar 3 days a week. Is a lot of commitment for those patients for 12-week, 3-month period. So we really wanted to improve that participation rate. We have great systems in place to get patients from inpatient outpatient, but it was still a 37%. And so we worked hard with developing the relationship between Highmark. We have a vital team there that actually implements the innovations to see how they do with data, to work on the reimbursement structure, to adopt the program into the network if it's financially feasible, of course, but also looking at the data to prove that efficacy and the economic, data, John with patient experience and other patients, we're looking at all that to get things approved, and we tested it out, and it's gone really, really well so far. We're still in the test period, trying to finalize that up and wrap that up within the next, by the end of the year.
Awesome.
And just to kind of talk a little bit about the program itself and how we've implemented it here in Allegheny Health Network, is that Moving Analytics has been great in really not asking us to pull from our teams within Allegheny Health Network to implement the program in the test model. So they actually have provided all the team players, the program coordinators, the care managers. With that, the program coordinator is identifying the patients and providing them with the smart application, downloading that on their smart device, their care kit, their mobile app, their devices such as the blood pressure cuff and the scale, and the education materials are all given to the patient prior and during enrollment. Next slide. And how we do that, how we find these patients, the program coordinators are just like part of us as part of Allegheny Health Network. They're working alongside our inpatient crew in that they are identifying patients by looking at our EMR and looking at the cardiac floors and such, as far as, first who has the insurance, the Highmark insurance that we provide or our members have. Then what is their eligibility as far as inclusion criteria, including diagnosis, which you can see there. Anything CAD related, including TAVR, open heart surgery, valve repair, replacement, and even stable chronic heart failure. Looking at your low to high risk patients, depending on the patient, and getting them into the program. Next slide, please. So that program coordinator piece is very important to implement. That's really your first out of the gate person. And again, I mentioned, and I forgot to kind of say, is that this is something on our inpatient side. These program coordinators are working side by side with that inpatient cardiac rehab team. And when the inpatient cardiac rehab team goes into the room, they really are identifying which program works best for that patient and offering both up. So whether they, are more of a candidate for that virtual cardiac rehab platform, or are they more appropriate or too high of risk for that, and get them into the brick and mortar program. So they're a very important part of the team, and they really are the boots on the ground, really screening for eligibility and collecting those baseline assessments, and then essentially getting that patient enrolled and doing the warm handoff, which I'm going to do over to, I believe, Faith Bockel here to talk a little bit about her case management piece as well. Before I do that, this kind of again mentions the package that the patient receives at enrollment. So they are actually getting the smart application and help and assist, technological help if needed, to get that smart application loaded on that smart device. They're also receiving their education materials, which mirrors brick and mortar cardiac rehab, and also the Bluetooth entities such as the blood pressure cuff, the scale, as well as a fitness tracker. So all of that is the package deal that they receive, and some exercise bands as well if they don't have access to strength training equipment and things of that sort. So it's a very comprehensive package that those patients receive before they actually get a warm handoff to Faith.
Thank you for that, Beth.
Sure.
So the care manager's role is to see the patient through. Once they've been handed off, they have all their devices. And so during that first call with them, much like an intake in a traditional brick and mortar, we go over their medical history, we review their medications, discuss emergency planning, establish those short-term and long-term goals, and set up their personalized care plan. So some components of the care plan include all the risk, usual risk factor modification, exercise, nutrition, stress management, is our psychosocial piece, smoking cessation, and secondary prevention meds. Most of our patients go through a symptom-limited treadmill test, and the goal is to get them doing 150 minutes of moderate to intense exercise per week. We're currently using Rate Your Plate for our nutrition piece. We're looking at weight loss or weight maintenance goals, cholesterol, blood sugar control. In terms of the psychosocial piece, we're using the PHQ-9 and GAD-7 to help, help the care manager speak to the patient about their depression and anxiety issues if they exist. For smoking cessation, we use a smoking status tool. We also have a smoking confidence if the person is a recent smoker or is current smoker or has recently quit. And we reassess this throughout the program. In terms of medications, we do a medication reconciliation during that first call. We look at their lipids and any blood pressures and heart rates that they have plugged into the app in that first couple of days before they reach the care manager. Okay, so during the throughout the cardiac rehab, virtual cardiac rehab, the patient is using the app to do their self-managed care. So if you look at the screen, you can see a to-do list. So they can record their exercise, they can record their blood pressure, their weight, tell us that they've taken their medication. If they're diabetic, you would see blood sugar on here as well. They also have access to our education library right through the app under our resource section. You all can also see reminders every day, or based on the personalized care plan, it may be weekly, the patient's going to get reminders to log their blood pressure, log their blood sugar. Could be several times a day. If there's no need to log something daily, like their weight, they may be logging that just once a week. They can also track their vital signs. So once they put their information into the app, they have the ability to go back and check their progress. And then there's also messaging, which we call chats. So it's essentially a secure text message system where they can reach their care manager directly and chat back and forth as many times as they need to in between their calls. So the patient is encouraged to complete 3 to 5 exercise sessions per week at home. And part of what we do on that initial call and the subsequent calls is ask the patient, what they are accustomed to doing, what they're comfortable doing, and then guide them through exercises, whether it's a walking program, using videos, a piece of equipment. A lot of our patients go to the gym, so that we're, building on what they were already doing. We provide them with resistance bands in the kit that they receive, so we walk them through that. If they have any weights or they're doing weights at the gym, we're again walking them through how to do those, how to progress through that as well. So the patient receives up to 12 telehealth coaching sessions. So some of the topics that we address with the patient: exercise, nutrition, stress management, medication adherence, tobacco cessation if they're a recent smoker or a current smoker, weight management, blood sugar control if they're diabetic, and blood pressure control. Okay. So throughout the remote cardiac rehab, the patient is able to keep in contact with the care manager through those chats that I talked about earlier, but we also have alerts built into the system so the patient can report symptoms. Also, if they record an elevated blood pressure, it will come through as a symptom alert. If there's an irregular heart rate, that will record as well. If they've gained a few pounds overnight or over 5 pounds in a week, that will give us a symptom alert as well. So we're able to go in as frequently as needed to look at their vital signs and check their adherence. So if a patient is not adhering to their care plan, which is essentially their exercise prescription, and not putting in the information that we've discussed with them and agreed to, then it will give us an adherence alert, and it's an opportunity for us to reach out to them through chat or perhaps a phone call to see if there's any issues, or just give them some reassurance that we're looking for that information so that they can go ahead and log that. The care manager can, can you go back one, Ade?
Yeah.
The care manager can respond to and triage symptom alerts within 24 hours. When needed, we escalate these issues to the providers, whether it's their family doctor, cardiologist, or endocrinologist, or other specialist. So go ahead. So after 12 weeks, much like traditional cardiac rehab, the patient graduates and then they move into a self-monitored maintenance program. At this point, we're doing monthly calls with that patient. And then at the end of those 3 months, when they're completing maintenance, we go through and do a complete overview of their progress from the first 3 months, but also the last 3 months that we have been working with the patient. So essentially they have a a sort of midway graduation and then a 6-month graduation through the Highmark program. So they're again getting another evaluation, and we're going through that as well. And much like in brick and mortar, we are giving them all the tools and reminding them of the things they need to continue doing to continue to progress their exercise, know what to do in an emergency, again, reiterating the importance of taking their medications every day and following up with their providers.
Thanks, Faith. So we'll switch back to Beth, who kind of talks about the outcomes that, Highmark and Allegheny Health Network have seen by implementing the program.
Yeah, for sure. And one thing I did want to mention, which I didn't before, I kind of forgot, but we had implemented this test pilot right before COVID hit. And it was a huge blessing for us because we were able to transfer a lot of our brick and mortar patients over to moving analytics, and they can continue their cardiac rehab versus us, doing check-ins, which we did with all of our patients when we were closed for 3 months. And we kept, contact with our patients, but nothing like, Faith and her team were doing. So I just wanted to mention that it's been a great lifesaver for that instance in itself. But yeah, so with the outcome measurements here, I mentioned the opportunity assessment initially, and our participation rate, really, as you can see, has almost doubled here from 37% to 69%. So we feel like we've captured those patients that would not have attended brick and mortar due to the barriers that are, unfortunate for cardiac rehab. Graduation rate has improved as well. We were seeing an average of 24 sessions per patient out of 36. That's improved to 80%. And engagement per member is about 4.4 weekly. So average member for clinical outcomes is going to seeing based on Faith had mentioned all the outcome measures that we do with surveys and assessments. We're seeing a 44% reduction in depression, 60% reduction in time to initiate cardiac rehab, because oftentimes we have barriers of scheduling or with the patient's procedure, they have to wait a certain time to be cleared to exercise, whereas Faith can go in, or the team can go in and educate those patients prior to, so they get to start sooner with their virtual cardiac rehab. And then we are seeing what we wanted to see, reduction in readmissions, 50%. So we've enrolled 200 patients so far. We keep enrolling them daily, and it's just been a godsend and a great program to complement our brick and mortar programs that we have throughout the network.
Thanks so much, Beth, for sharing those outcomes. So we're going to switch now to more of like a panel style set format, where I'm going to be asking the different speakers just different questions to kind of get more in depth into the experience, and then we'll open up to a broader Q&A after. So let's switch to John, who's really been like one of the beneficiaries from this program as far as the patient's perspective. So John, just to kind of get some context, can you tell us more about what your cardiac event was and how you found out about the moving program? Johnny, I think you're muted.
There we go. Is that better?
Yes.
Yes, I'm happy to tell you about that. My cardiac event was February of last year, 2020, which was kind of right before COVID hit. And as Beth mentioned, it was really what I would say a godsend for me, from the standpoint, I was introduced to the program in the hospital by Haley, and we had agreed that was the route we were going to go, but it was initially going to be 2 weeks of like the brick and mortar, and then I would transition over into the moving analytics part. But I was only able to get a couple of sessions in at the hospital before, they shut everything down for COVID, and they said, hey, if you were going to do the remote anyway, why don't you just switch over to that? So that's what I did. Was introduced to Faith at that point. It's exactly the way you guys described it in your slides. I got the stuff. I guess Haley was the one that kind of made sure I got my welcome kit and everything. And then, once I got in contact with Faith, at the beginning it was once a week, and then every couple weeks, and then once a month. And the results for me were fantastic. I felt like the program was super easy to do. the app was a real blessing because it helps you keep track of so much stuff without having to worry about remember to do this, remember to do that. It prompts you for things like blood pressures, weights, that kind of stuff automatically gets loaded in. And I never had a problem. Not that I had many issues, but if I had a question or I was not sure of something, I knew I could easily get in touch with Faith. I did that a couple times through text, through phone calls. So I've got nothing but positive things to say about the program and how well it works, and would highly recommend it to anybody that is in this situation.
Thank you for sharing that, John. I'm curious, with a lot of, providers, they're always concerned about the technology, and if patients can use the technology. So I'm curious, did you have any hesitations in the beginning of the program about the technology, and what was your experience, during the program with it?
No, I can't say I had hesitations about the technology. I mean, the downloading of the app was pretty straightforward. And once you download the app pretty much does what you need it to do. There's not much you have to, do to set things up or other than create your account. But yeah, I felt like that was a very small hurdle to try to overcome.
Awesome. Glad to hear that. And what do you say was your favorite part of the program?
Talking to Faith each week.
Yeah, I feel like that's such an important part of it, right? Because, just going through the motions of after a cardiac event, I think to me and within the company, one of the things that we think it's very important is that human connection, right? That person.
Absolutely. And it verified, it's like, yeah, you're on the right track. You're doing the right things. And, she could see the results through the data that was getting put into the app. And, it's just reassurance that, yeah, you're making progress. You're doing the things you're supposed to do to give yourself the best chance to succeed. So, yeah, it was good.
Definitely. So if you had a patient who was kind of on the fence and they weren't sure about virtual rehab, some of the things we hear from patients is they kind of talk about feeling like they want to be monitored while they exercise because they're scared that if they exercise on their own, that they may get hurt or something. So I'm curious if you ever felt that way, and did you feel safe while exercising in the program?
I did. Now, my exercise at the beginning of it was largely just walking. Yep. So it wasn't, high stress. But then as we progressed, through the videos and things, and that was a part that I don't really think was brought out in some of this, was the videos and things that Faith let me see through the app were extremely beneficial. They really were educational. A lot of good information. There were workouts in there that I often did that because they were in the app, I didn't even have a hesitation like maybe I shouldn't be doing this. I mean, yep. She was very clear about where I needed to keep my heart rate and things like that. And as long as I did that, and that's what the equipment I was given was able to let me do that easily without a whole lot of trouble. I could easily tell what my heart rate and things were. So that was a huge peace of mind for me.
Awesome. Thank you for sharing your perspective, John. We really appreciate it. So let's switch to Faith and get some of her perspective on, being the rock star of this whole thing. I feel like when you ask any patient, what's the best part of the program, they say Faith and her team. So Faith, can you expand more on the role of a care manager at Movie Analytics and what they do?
So thank you for calling me a rock star. I've never been accused of that before. We've heard the word cheerleader, we've heard the word coach, encourager. I think that what really makes a difference in the human aspect is during that first few calls, really getting to know that person. And that's one of the things I think is really important. So, spending that one-on-one time with a patient, which is different than brick and mortar, in that in brick and mortar, you generally get that one first time where your time is dedicated to them. But my John's entire cardiac rehab experience, I was his dedicated care manager. So we got to know each other really well. And I think that, approaching it with empathy, our mantra at Moving Analytics is empathy guiding expertise. So getting to know John and then imparting my expertise is really always my priority, as is the care managers that are a part of our internal team, is really, letting them know that you're there to listen to them, but you're also there to guide them, with your expertise. So I feel like, that human interaction, that first interaction is really so vital, that we spend nearly an hour or more on the phone with a lot of these patients so that we can hear their story and, figure out how we can best help them move forward.
No, thank you for sharing that, Faith. One of the things people don't know about Faith is, so Faith was the actual nurse at the first hospital we implemented the moving program. And she had like over 30 years of experience in doing cardiac rehab in the brick and mortar way. And one of the things that really struck me when I first met Faith was, in the beginning when we started a company, lots of people had lots of questions and hesitations about like doing cardiac rehab remotely and if it was going to be as effective. And a lot of times they allowed those concerns kind of get in the way of, not a lot of people are getting care, and we need to find better ways to deliver care. And one of the things that just struck me in the first time I met Faith was just how innovative and open-minded she was. And she asked lots of questions, give us some feedback. And when we started to recruit our own, cardiac rehab staff within the company, it was just like a no-brainer for me to say, hey, Faith, would you want to come on board? And it's been a beautiful partnership so far. So Faith, as we think about like a lot of people in the audience today who are more the traditional cardiac rehab professionals, they've done cardiac rehab a certain way for decades. What do you think are the skills that, you've had to learn to transition from being like a, traditional cardiac rehab provider to a virtual rehab provider?
So I'd say one of the big hurdles, because, we are currently doing, phone calls with our patients. So I don't get to see what they're doing exercise-wise, is really developing the skills to explain what you want them to do in great detail. And then making sure that they explain back to you so that you know that they understand what you're doing. So there's a lot of frequent discussions in the beginning, a lot of chatting back and forth, referring to, the educational material. But a lot of that is gaining their trust, that you know what you're talking about and you're not going to let them do anything that's unsafe. And it's really about being, also being able to, hear somebody say, I have this kind of bike, this kind of treadmill, this kind of elliptical, and spending on some time off the phone call, looking at that piece of equipment, and then being able to go back and tell the person, I've looked at your piece of equipment. Let's just confirm that, this is, what you have, and these are the settings, and here's how you can utilize it, that piece of equipment, so that they're doing it safely and they can progress their exercise. And also troubleshooting their devices, learning how to use, not learning how to use, but learning how to, step by step guide somebody how to use a Fitbit or Garmin, or other fitness tracker, walking them through how to put that blood pressure cuff on correctly. If you see an off reading, just, telling the patient, well, you may have high blood pressure, but also let's make sure you're using that cuff correctly, and really kind of taking a step back, putting yourself in their shoes to, give them those reassurances. When you're in person, I'd be the one putting that blood pressure cuff on them, so I'd know that it was correct. Or if it wasn't, if I didn't put it on correctly, I would readjust it. Whereas, you're having to walk the patient through doing that. And I think really having the patience, in addition to the empathy, to take your time with the patients is very important.
Thank you for sharing that, Faith. Can you talk about some of the differences, right, in the approaches, right? So, a lot of times, and I think one of the things we're seeing as virtual cardiac rehab, thanks to COVID, gets more widely adopted, is the different styles of virtual rehab. Some people are doing like the one-on-one type model where they're on video watching a patient exercise. We believe in more of the self-management philosophy of, we're going to teach patients the right way to do things so that they can do it on their own, but we'll be a coach and we'll be a guide to kind of guide them through the process so that, they're empowered and they don't need to be dependent on us, for every little thing. So I'm just curious, from your perspective, again, thinking about traditional cardiac rehab, I'm thinking about our own particular model and moving analytics. Can you talk more about some of the nuances and the differences, that you think are important to highlight between, our model and the brick and mortar model?
Yeah, one of the things that really, sort of pulled me in the direction of where moving analytics is going is that one-on-one time that you don't have in brick and mortar. So while we work harder to make sure people are exercising safely, reiterate, over the phone how to check your heart rate, check your blood pressure, record your other vital signs, really being able to take a deep dive into what the patient's goals are one-on-one is one of the big things that I see is a benefit. When I was in my, prior employment, we taught group classes and not everybody was at the same place at the same time. So while we tried to individualize it as much as we could, I spent, 6 months with John talking about nutrition, talking about how to manage blood sugar, how to manage blood pressure, and really focus in on his specific needs and things that were important to him. I think that's one of the big differences. And one of the things that I really like is being able to spend that one-on-one time. I mean, I like to think that he came out of it knowing what to do and feeling confident. And I feel like I came out with it knowing that I have a friend out in Pittsburgh.
No doubt.
Definitely. Thank you for sharing that, Faith. One of the things we also have in moving analytics, right, is so we have the care managers, right, who are the typical cardiac rehab RNs and EPs who actually do a lot of the one-on-one with patients. But we also have the program coordinators. Can you speak more about that role and why that's important?
Yeah. Okay. So our program coordinators are recruiting patients, getting them set up. They're essentially, they're the first line people that they're selling the program and telling everybody what we're doing and the good outcomes that we're getting. So if they do their job and do it well, that's how we're going to get patients to learn and trust us and know that we're going to take care of them. So they're out there, talking to the patients. Initially we were doing that in person, then COVID hit. They restricted how many times they could go into the hospital. So they started doing that virtually. So they're calling patients, doing essentially a cold call to a patient, explaining who they were, what we're doing. We're working with Highmark, and they have done a superb job of taking someone who wasn't sure which direction to go, maybe at that time didn't have a brick and mortar to go to, and took them to a place of confidence where they were able to enroll in our program and see their way through graduation. So without the program coordinators, the care managers would not have any patients to take care of.
Definitely. And just a plug for us. So if people on the call here are interested in joining our care team, how can they find out about our positions and what's the process?
Well, so they can go to our website.
Okay.
Which I don't know if it's posted up there.
We have a link to it at the end.
Yeah, we'll make sure we go ahead and post it up. They can go to our website. We encourage you. We have positions open, and we're looking for empathetic, experienced care managers.
Awesome. Thank you, Faith. So let's switch it to Beth before we open it up to the broader Q&A. So Beth, one of the things I always get asked, by different health system leaders is, how do you choose patients? Like, we kind of talked about it very briefly, in the slides, in terms of that patient selection. Sometimes, it gets thrown out that, cardiac rehab is better suited for low to moderate risk, but we've seen even some of the higher risk patients. So can you walk me through, some of your thinking in terms of just how we're making those decisions on who's a good fit for virtual, or not?
Yeah, I really think that it comes down to the patient and what works for them. And as you can see, we've really captured those with adding the moving analytics platform into our service line. But really, it really, like John explained too, it worked for him. He tried the brick and mortar. COVID hit, and he unfortunately wanted to transfer and got it was great that he got into the virtual platform and didn't have to put things on hold. But really, if it works for the patient as far as their schedule, lack of transportation. I know we're getting we kind of thought that the hypothesis would be we'd have a younger population taking advantage of the virtual cardiac rehab, but we have some older folks, in their 80s and 90s that are in the program, and they're maybe a little bit of a moderate to higher risk patient because of their comorbidities, but they're able to use the smart application and do the device. They don't have transportation to get to us 3 days a week. So I really think that it's patient-based, case by case, and what works best for that patient. Some patients like Faith said, I agree, one-on-one, we thrive for that as staff in cardiac rehab. It just doesn't work out because we have, group classes, 8 to upwards of one of my facilities has 24 patients in a class. So you're scaling that up pretty large, and you get even less time with those patients. But really that one-on-one contact works out for those patients too. Granted, some patients like to have a group session to go and socialize with, but it sounds like Faith is doing a great job at helping with that socialization aspect. And she has the experience and expertise and all that stuff, and is, I'm sure, brighten John's day sometimes, and John sounds like he's brightened her day sometimes. So I think it's a great partnership between everybody involved. But it's really what is best patient practice, what's best for that patient, and they really need to choose that that offering when it's offered initially. Here's what we have here, here's what we have here. What do you think works best for you and your schedule and your family and all your responsibilities in life? Because life is busy and crazy, and it's it's just a good option, another option to have for cardiac rehab.
Yep. No, that's helpful. One of the things we're doing that I think is very unique in the market is that, you're implementing the program in a way, in an outsourced fashion, right? Where you're relying on our own clinical team to deliver it in coordination with your team. And, I think that's one of the things I feel like a lot of organizations are very scared about, so I'm kind of curious if you could kind of share your initial thoughts about the model and how's that evolved over time as we've established our relationship.
Yeah, I think reservations on it being, patients getting into a virtual platform were kind of scary, just because we're also used to being, staff members that are EKG monitoring our patients. But then you have to think, okay, well, they're with us 3 days a week in the brick and mortar facility. They're obviously exercising outside of that, not on a heart monitor. So that kind of put into perspective for me that it's okay, because we're, still checking in with those patients when they come to us, when they're with us in the brick and mortar setting. And they are actually okay. So I think reservations as far as that, but just, getting to know, I mean, the relationship has been seamless. I mean, the team is amazing. They're nurses and clinical exercise physiologists like us, and there may be reservations about the program because we didn't know really what it was, but in the evolution of it, we realized that, Faith is great in what she does, is case management. She's just, a staff member who has that expertise and empathy, and is really good with her patients. Even the program coordinator enrollment team, they're clinical exercise physiologists, and they know all about cardiac rehab. And I think that was important too, to know that the people we were having in our facilities at Allegheny Health Network were actually clinical people, knowing, what they were doing and how to identify appropriate patients for the appropriate program. So it's been a great partnership, and the reservations I had are no longer. The program's evolved into an awesome thing, and I just am blessed I get to be a part of it and continue it on at Allegheny Health Network.
Yeah, and you've been a wonderful champion, Beth. I think one of the things I think about, with our experience now working with several organizations is, you really need leaders, especially within cardiac rehab, that believe in this. I think sometimes there's some fear, especially from the cardiac rehab community, that, virtual is going to take away, the in-person, program, or it's going to steer patients away.
Good point.
And, I think one of the things I really appreciate about our partnership is that you've always kind of thought about how do we grow the size of the pie, right? How do we grow the number of people who can get access to cardiac rehab, and really give patients the choice. And if you give patients a choice, naturally some people prefer to be in an in-person setting, so they gravitate towards that, right? And some people want to do it virtually, and it's more about that choice for the patient. So I think that's just that belief that you've had from day one of just,
Yeah.
hey, we want to increase access, and that's the name of the game.
Yep.
To me, that's just been one of the key reasons why we've been very successful, is because of you just have that confidence. So thank you.
Yeah, we definitely picked up on those folks that weren't going to do brick and mortar. I mean, and even the ones that may have said, hey, this fits better into my life. But no, we've definitely captured the ones we missed. And it's just awesome that we've been able to touch that many people and case manage them in a way that we've reduced readmissions, and they're not as sick anymore. So we're going to be sick. So it's great.
Yeah. So one of the things I'm curious from your perspective is, beyond COVID, beyond this vital test, how do you see all these models coexisting, right? Like in terms of just in the future?
I think that it's we have to do this. It's what's best for our patients, to give them options. It's going to coexist at Allegheny Health Network just because it's the best thing to do for them. We close cardiac rehab down again because of another pandemic or something, we have an option. We don't just say, oh, sorry, you can't come to cardiac rehab or do cardiac rehab anymore. We have an option for you. It just has to be a standard thing that we do moving forward, whether it's us doing it or moving analytics doing it or a hybrid approach. We need to continue the service on just because it's so great from an outcome perspective, and just the capture rate of participation for inpatient outpatient almost doubled. So we just have to do it. It's what's best.
No, I totally agree. And the last question is, thinking about Highmark as the health plan, right? And if you can put on that hat for a little bit, why do you think increasing access to cardiac rehab is important to a health plan like Highmark? And how and I think that's important, right? Because of one of the things we've all experienced with virtual cardiac rehab is still the issues with reimbursement, right? And we're not really sure post the PHE how this is going to evolve. And one of the things we've been able to do is get the commercial payers to pay for this. So I'm curious, just for the rest of the people on the line, so that, as they think about their advocacy and, how they engage their payers, what has been, the motivation from a Highmark's perspective to do this?
Oh, because cardiac rehab works. We get our hands on these patients. We case manage these patients. We keep them out of the hospital. It saves that insurance company money. The payment, the reimbursement we get for cardiac rehab is, a lot less than a hospital stay and what all we have to put into that patient when they're sick. So that's a huge piece of that just in itself. And the return on investment is huge. For the more patients we get in, the less likely they're and get our hands on them, the less likely they are to be sick. So that in itself is proof there. We've that.
One of the things I tell health plans whenever I meet them, I'm like, hey, if you look at your census, maybe 40% of your patients are getting readmitted, and it costs you almost $30,000 per readmission.
Yep.
And you think about the fact that we've been able to reduce that by half. Just think about thousands of patients getting readmitted at a cost. I think that the benefit of cardiac rehab is definitely understated.
Yep.
So thank you all the panelists for just sharing your experience and your perspective.